Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Hello everybody, welcome back to another episode of A Slice of Health, and today we have Dr. Lean, that is DOCTOR.lean on Instagram for you guys, and she is joining us today to bust some health myths relating to somatization. So today we're going to be asking, is it true that women are more prone to somatize, and is fibromyalgia a real illness, or is it a health myth or a health fad? What do you think, Dr. Lean?
Great. So, hi guys. Thank you so much for having
me. Thanks for joining us today. I'm so happy to see you and to have you on the episode.
Yay.
And I hope you're going to be a recurring guest as well.
Of course, I'd love to. Yeah. Just a bit of an introduction. So, I'm a GP that's currently working in London.
Yes.
And Dami and I were together in medical school, so it's so nice that we're still having this relationship.
Yeah, this was 10 years ago, wasn't it?
I know, it's crazy.
Time goes by so quickly.
Yeah.
The first day I saw Lean, I walked up to her. I think we were on a bus going out, Freshers Week, and I saw her and I was like, you know, you look so much like Queen Rania of Jordan.
Oh my God, I love it. She's so beautiful.
Yeah, and she was like, oh yeah, I'm Jordanian. And I was like, hi.
Oh, you didn't know I was Jordanian?
I didn't know.
Oh my, that's amazing.
But I just saw you, and obviously like Queen Rania, she's just so classy, and she's
just
so lovely. Yeah. And I was like, oh hi. And so Lean is a GP in London currently. And what are your special interests, Lean?
So I'm currently training in functional medicine. I don't know if you've heard of it before.
Tell us a bit more about it.
Yes, so it's basically learning how to prevent disease. Mm-hmm. So I'm really interested in preventing a disease rather than, of course, treating a disease after it happens. Yeah. But my ideal situation is to prevent it before it happens. Yeah. So it's basically knowing the risk factors of a patient, their family history, their lifestyle, and then taking all of these to know what they're more likely to develop, and then targeting these to prevent that from happening.
Yeah, and that is so important, isn't it? Because most of the illnesses that we treat currently are things that could have been prevented.
Exactly.
You know,
heart
disease, certain kinds of cancer, diabetes, especially type 2 diabetes.
Most of them, aren't they? Because most diseases have modifiable and
non-modifiable risk factors.
So what that means is modifiable risk factors are basically
that you can change.
That we can change, exactly. And non-modifiable, such as sex and age, which are things that
and
we
your
can't
genetics
do.
As well. You didn't choose your mom and dad, did you?
No.
But there's a lot that you can do in terms of, you know, how much alcohol you have, how much exercise you get, what kind of diet you're eating, you know, and the kind of choices that you make on a daily basis definitely has an impact on your long-term
and
health.
Even knowing the kind of symptoms for a disease that you're likely more to develop, and then knowing the early signs, that can help you prevent it from happening initially. So,
definitely. That is really interesting. That must be really interesting in terms of sort of learning, and then also sort of trying to counter people's health beliefs as well.
Exactly.
In terms of like preventative medicine, because you're talking to them about, okay, these things that you're doing, actually they're not setting you on the right track in terms of going forward. Do you feel as though you get a lot of resistance from people?
So I'm seeing a lot of patients in NHS, in my NHS clinic. They tell me about their family history and try to tell them, you know, we need to change some things. They understand, but not a lot of them implement. So it's just trying to really take that passion and willpower to try and change it.
And sort of the cycle of change, isn't it? You know, sort of pre-contemplation. A lot of people sort of get stuck in that area. And they probably need a bit of motivational interviewing to get them going. And maybe a good life coach to you know.
Exactly. You need more time. That's my issue. I need more time with patients.
Yeah, and I suppose this is a thing that keeps coming up actually, because on one of the episodes I did recently, it was we ended the episode talking about actually needing more time with patients.
Absolutely.
And it was also another GP, Dr. Honey, and she was saying, oh please, just ask the reception to give you a double appointment. Yeah, you know, especially when you're coming in, or even a triple appointment if you need 30 minutes. It then allows your doctor to be able to explore your concerns in a detailed way, and also for the doctors to then be able to also address the medical concerns, and also potentially your mental health needs as well.
Yeah, exactly. A person has so many needs, doesn't it? Physical, mental,
to a person.
Yeah.
Well, that's really great. That all sounds really exciting. Actually, you know what? We should get you back and talk a bit more about, preventing
diseases,
and preventing diseases and diet, exercise, alcohol, things like that. That would be really great.
Yeah.
But getting to today's episode, so we're talking about somatization and fibromyalgia.
Yeah, it's a great topic actually. We'll probably so many things to discuss about it.
I know. We might not even be able to finish it in this episode, so we probably would actually come back to it.
Yeah.
What's your take on sort of fibromyalgia?
So we were just talking before we started this podcast is that there's so many people with fibromyalgia that I see in my clinic, and we were just thinking that most of them are women, and I was just reading the literature, and about fibromyalgia is times 7 in women than compared to men.
That is quite a lot,
and
actually.
Why do you think that's the case? So women, we were discussing as well that women do have a lot of stress in life compared to, they are expected to do a lot of things.
More. Yeah.
So that could be one of the factors why it's more common in women.
Maybe we should tell the people what fibromyalgia is actually. Because I think sometimes, I don't know, I feel as though sometimes people experience things but they just don't know how to articulate what is going on, and I feel quite a lot of women potentially actually experience the symptoms of fibromyalgia without actually knowing, having a diagnosis, knowing actually what is this thing that I am feeling. I'm feeling pain in my body, but I can't actually experience or say to the doctor that, oh, it hurts me everywhere, and anywhere anybody touches me it really hurts. How would you describe fibromyalgia in sort of a simple way to people?
So fibromyalgia is basically a syndrome, which what that means is it can present in a lot of ways. So it can be presenting in intense pain, it could be fatigue and tiredness, it could be tummy cramps, nausea, sometimes it's just feeling unwell, feeling weak. So it's very unspecific. You can't really pinpoint on something that's causing it. And most people cannot find the trigger for all of these symptoms, which makes it harder and frustrating for patients.
Definitely.
And also for doctors, because it's difficult to help a patient, and when we examine them and do tests such as blood tests and sometimes ultrasounds or x-rays, and they all come back as normal, it's still frustrating because even though everything is normal, it's still there's no answer or explanation for these people.
I think that is quite difficult, isn't it? Because you're sort of designed to either prevent or diagnose and then treat something.
Exactly.
And if you don't have a diagnosis that has a treatment that is a proven evidence-based treatment, then it becomes really difficult to manage. And I think the way doctors are trained in sort of modern day medicine, it's so different. They do try to make it as holistic as possible, but I think it's very difficult. It is very difficult, and it's sort of like a sort of machine line where you add this and then it gives it this, as opposed to actually then being able to explore a little bit more, because there's no cure for fibromyalgia.
Not as far as I know.
So there
are medications to try and help with the symptoms.
So it's more about symptom control, isn't it? Than an actual cure that, it's not like an antibiotic prescription that, okay, you take this antibiotic for this duration of time, it will make your infection better. And if your infection is not better, we'll give you another course of antibiotics or we'll wash it out.
Exactly. It's not like that.
It's not like that.
It's probably because we don't know what the cause is, so there's probably no cure for it. But it has been linked to mental health problems and such as depression and anxiety. It's very commonly you see people with depression, anxiety who have fibromyalgia.
Yeah, definitely. And I think that brings us to the somatization we were talking about, in terms of the fact that women are actually more likely to experience physical pain when they are under stress.
Absolutely.
Or when they have emotional baggage, emotional trauma. And I think there's just a thing now about people not being able to process their trauma as well. I feel a lot of people have a lot of baggage from their past. I think we were just talking about emotional trauma and people's baggage as well. We actually were. And I think people don't necessarily have as many outlets to be able to discuss what different life experiences have done to them, and women do seem to somatize in sort of physical pain, and potentially sort of our communities as well, maybe the ethnic communities as well. Do you feel as though women in sort of our communities are more likely to feel aches and pains in their body that they can't really articulate?
Good point. It could be the fact that they're not able to express how they're feeling from a language barrier, which can make it much more difficult. And it could also be a cultural thing where they're not supposed to explain their symptoms, specifically if it's related to anxiety and depression.
Or the situation in the home. I think maybe in some of our communities as well, maybe women, the way women are supposed to express themselves, and I think women generally are supposed to be seen as, oh, just grin and bear it, and just just be happy all the time, and you're not allowed to actually say, okay, these are the things that are bothering me, and these are the things that are really affecting me. But what do you think, sort of in terms of fibromyalgia, let's say maybe the physical side of things and the physical pain and the aches, what have you found helps people other than tablets? Because we know, because I think a lot of times as well, like taking pain medication for generalized aches and pains, you then eventually start to build up a tolerance level. And we find that with a lot of pain medications, don't we? Especially things like morphine and codeine, where your brain then begins to then become used to certain levels, where, I don't know, maybe 5 milligrams of an opioid medication would have been sufficient for you 10 years ago for the same level of pain, but in another couple of years you need 50 milligrams, and it continues to go up that way without. So what have you found?
You see it as well in the clinical practice. If people come in with fibromyalgia symptoms, you start them on medication, they still keep coming back because they're not satisfied, it's not helping. Maybe yes, it can help for the short period of time, but they will come back. There are other things which we can do to help with fibromyalgia, which I found in clinical practice to have been more helpful than medications, such as talking therapies and CBT.
That is so important.
Very important.
I think it's so important.
Because it's all about knowing how you're feeling and trying to deal with it and trying to know how to cope with it rather than, taking a medication to try and numb it down a little bit and then we'll come back again. Because having these physical symptoms are not easy. I've experienced them. I'm sure other old women really experience and definitely. Even men experience these symptoms and that are not medically explained. So it is difficult. So it's all about knowing that these symptoms can be and actually accepting it. That's the big part of accepting that it is emotional as well. And that's causing your symptoms. And once you accept it, you're more likely that will be an initial step to help you with managing it.
And I think that is so important as well, what you just said in terms of accepting that there is a mental side of things.
Absolutely.
And health is not just about what we can see. It's not just about, oh, there's a lump, I can cut it out, or there's a broken bone, I can patch it up. It's also about what is going on in the part that we cannot see, which is the mental part, which is not even seen in the slices of the brain. It's a lot more complex than that. And I think people, we're getting better now at talking about mental health, but I think there's still a lot of stigma attached to talking about mental health. And I think once people realize that actually there is a component of my current illness that is related to the way I process information, the way I think about things, the kind of thought patterns that I have. I don't know if you've heard of Ian Lavazant. No, she calls it dominant negative thought patterns. And I think and that's the thing, isn't it? It's you have these dominant negative thoughts and then you recycle them and you recycle them and you recycle them, and people don't realize actually that they have these dominant negative thoughts and they can then trickle down into your life in other ways. I suppose that's where CBT comes in, isn't it? Where you're then addressing and you're challenging these thoughts and you're saying, okay, what exactly am I actively thinking right now, and is that actually logical? Is it true? Is it is it wise? And is it helpful as well? And mindfulness
Absolutely, yes. Meditation.
Yes.
I've just
So
recently
important.
started doing meditation. Yes, it's just amazing.
Yeah.
I don't take a lot of time doing it. I just use about 5 minutes of my time every day.
Yeah.
But I feel that we need it. You know, it's not just GPs or doctors or, you know, lawyers who are having, you know, very stressful time. It's which we were saying. It's everyone is expected to be perfect in the way they look, in the way they work, in the way
to have a perfect Instagram photo.
Oh my god. It's so difficult, by the way.
It is. Oh yeah, well, I mean, you're the professional.
Well, you need the light. Well, I'm learning.
But you're really good actually.
Thank
Your
you,
Instagram
thank
is
you.
actually really popping. That is
Yeah.
Dr.Lee on
Thank you,
Instagram.
guys.
But yeah, meditation, mindfulness.
Yes. I'm using this app at the moment,
Oh,
Mindspace.
Okay.
Which is just brilliant, and
Yeah.
it just takes a couple of minutes
Yeah.
of your time,
Yeah.
and it just takes you through the process, especially if you're a basic person trying to, you know, starting from basics of meditation. Which has been helpful.
That is really good. And I think that, you know, meditation is so great. And I think in terms of religion as well, so I think different religions do meditation in different ways.
Yeah.
So some religions do meditation in sort of an emptying your mind process, of just clearing out your mind.
Yeah.
And then some religions do meditation in actually filling your mind and ruminating on certain good thoughts and positive thoughts, and just meditating on a good affirmation at the beginning of the day.
Yeah.
And I think whichever way you find meditation helpful for you, I think just having that time to quiet your spirit and either fill it with good things or empty it of negative things, I think it's so important.
Yeah.
So important. And that's really good. But what about like other therapies for like fibromyalgia, like massage, acupuncture?
Acupuncture, yes. So I've actually seen acupuncture work. I've worked in a previous GP practice where one of the senior GPs used to do acupuncture for patients, and I had a lot of patients coming in. Where is she? I want my acupuncture. Really helped. And it's just it's something that needs to be explored a bit more with the NHS. I feel. So and I think it's what works for your body really.
Yeah.
So if you feel that acupuncture does help, or massage does help, or osteopath helps, then that's helping you, so just keep doing it. If you feel that it's not helping, then try something else. So it's all about seeing what works for you.
And I think knowing your body as well.
And
I think as women, there are a lot of things in terms of obviously hormones. That is such an important thing. And there's this book that I've been reading. Oh gosh, it's got a profane title, but the it's called Moody.
Okay.
And the second word is Bitches.
Okay.
And it's written by it's written by it's just my mom might listen to this podcast, so if she hears me say that word, she'd be like, whoa,
calm down.
But it's actually a really good book, and the tagline, actually, you know what, let me find the specific tagline, because it's written by this American psychiatrist, and she basically addresses quite a lot of issues that women face in terms of their mental health, and also the medication that we take, the pills that we take, and how all of that affects us in lots of different ways.
Absolutely,
and so she addresses the issues of the use of certain antidepressant medication, and apparently at a point in America, aripiprazole was the first line treatment that people were using to treat depression in women.
Wow.
And that is an antipsychotic medication. And what she was saying was, actually, in a lot of these women, what she was finding was they didn't need any medication. They needed a prescription for exercise and fresh air.
Exactly.
And that you wake up in the morning at 7 o'clock, and if you were working at 9 o'clock, wake up in the morning and just go outside and just walk. Have a cup of coffee and just go walking for 30 minutes, come back in, have a good breakfast and go to work. And she was finding that the exposure to sunlight early in the morning, fresh air, the physical exercise, which releases endorphins, which are naturally they're natural hormones, aren't they? Natural chemicals for pleasure. Actually made these women feel a lot better, and they did not need to be popping a pill every single morning.
Absolutely, it's their type of meditation, isn't it? Just going and just
mindfulness and things. And also she was talking about the pill and the certain, you know, how so many, and that's what I've actually found in practice as well. So many women respond to the different pills in such different ways.
Yeah, absolutely, I've seen that as well. Yeah,
and and some women would come in and would be like, "Oh, my partner thinks that I've changed.
Yeah,
and that I'm like, can I have a different pill?" And I'm like, yeah, you can definitely have a different pill, because these hormones can definitely affect the way your body responds. And the tagline for her book is "The truth about the drugs you're taking, the sleep you're missing, the sex you're not having, and what is really making you crazy," by Dr. Julie Holland.
That sounds like a good book.
Actually, it's quite a thick book, but it's actually really good. And I think as a medic as well, just reading it, I can actually see quite a lot of things in practice where people are experiencing things that they're not really able to understand, but little things in like sort of preventative medicine can come in and help them in terms of addressing that as well. And how would you recommend women understand their own responses to their own hormones?
I was just going to say actually that if you think medically of how the hormones for every woman, so just before when our periods start, that's when we have very, very little hormone of both progesterone and estrogen, which are female hormones basically. And then when you and then they start going up and up and up and up and up to a certain point where the egg is released, and then once you have your period, just before you have your period, these hormones just drop. So imagine what is happening in our body. It's just crazy. The hormones are just all over the place. They're up and down, up and down. So that kind of explains a little bit of how we're feeling when it comes to our mood, and especially PMSing and getting very moody. So that's something that's very unique for women that men do not have. So that can be actually a part of, how of somatization, maybe definitely. Of having these hormones all over, and that can give us some physical symptoms as well.
Definitely. And I think in terms of that as well, it affects so much, doesn't it? Because
it's crazy.
There's a peak, and then you get to that really fertile point.
Exactly.
And
then boom.
And then boom, and you feel so happy, and you feel a lot more in love, and a lot more amorous at that time. And women, be very careful. Okay, do not declare love to a man between day 10 and 17 of your period, of your cycle, just because like your hormones are at their peak.
Absolutely.
And you can make certain decisions in that time period that you would not have made at other times, when you are slightly more logical in terms of your cycle.
But you see how much hormones can affect us.
It really
crazy.
does. You're happier, you're you just, I don't know, there's just something different about it. But then does that also mean that, because obviously with that as well, so some women then want to have sort of an even kill in terms of their period or their hormones, and so they want to then have hormones taken in consistently that are giving them the same level of
hormone level
that is consistent. But then it does depend on you, and I think every woman should talk to their doctor about it, because obviously some women will find that just keeps them very labile in terms of their responses, because you're not having those peaks anymore. And then some women actually don't like that, because they actually like having a time of the month where they are a bit happier and a bit more pleasant, a bit more energized, feeling a bit more in love.
It keeps you on your toes, doesn't
it? And so definitely speak to your doctor about it.
Absolutely.
in terms of what is best for you, and obviously with your risk factors as well. Not everybody can have every kind of pill. But what about seeking help for mental health illness when you're realizing that actually, my physical symptoms are not, there's no physical cause for it, and you don't want to go down the route of tablets for painkillers? What about sort of use of antidepressants in managing those kind of symptoms? What have you found? Do you find that people are actually they do better, or do you find that it actually isn't as effective?
It's very varied really in practice. As you said, it does depend on the person. I've seen a lot of people saying that they've really worked and I really want to go back on it, and when someone on it, it's just I'm back to normal. And I've seen other people say I feel like a zombie on it. I don't want to go back, and talking therapies have helped me more. And you see other people who actually get worse on it. It's just really depend on the person.
It really does, doesn't it?
But actually research have found that a combination of both medications and talking therapies have been more effective than anything else.
Yeah, definitely. And I think that is something that I always try to do in terms of, because I think people feel a barrier in terms of, oh, am I going to go talk to a stranger about how I feel?
Yeah, exactly.
And I think we just need to be a bit more open about that, because people, a lot of times, some people feel that, oh, I'll just take a pill and I'll feel better. And you might do, but the thing about therapy is that it gives you the coping strategies to then be able to address certain issues. And so when you're having certain difficulties, you know what to do, you know what exercises
it will help you long
to
term,
do. And it gives it gives you the skills long term to be able to then help you through those issues, coping mechanisms, things that you can teach other people as well. You know, if you see someone having a panic attack, you'll be able to know, okay, these are the ways to do breathing exercises, or certain tapping on your thymus, or you know, little things that you learn through therapy that you might not be able to learn
with
by
medication.
taking a pill. And also there's online CBT as well, so it doesn't have to be with the therapist. And that seems to have just as good effects as sort of having like face-to-face therapy.
But for people who are on medication, it's not a bad thing.
There
are some stigmas with medications. There's so much stigma with
medication.
So if it's working for you, then definitely continue taking it. It does, with medications of antidepressant, it takes a long time for it to work. It can take up to 4 to 6 weeks.
You might need to titrate that up as well.
Exactly, yes, but it's not a bad thing. And if you are on medication, you feel that it's helping, then definitely continue. And advice would be to continue on it for a bit longer after you feel that you've gone back to normal.
Remission. Exactly.
So give it a couple of months, up to 6 months of when you're feeling normal, and then start to titrate down or stop it afterwards. I actually got a lot of people asking me about antidepressants, and once they are they allowed to just stop, or should they titrate down? And that's a very difficult question to answer.
That is a difficult question, isn't it?
The research has shown that if you just suddenly stop, it's not supposed to give you that addictiveness or tolerance, so you're able to just cold turkey and stop it. But a lot of clinical practice has shown us that
that's not the
don't
same.
Do that.
Yes,
it's very
and
odd.
It is extremely odd. And what I've actually realized now is, obviously, I think we need to do a lot more research into antidepressants because, and I know I used the word remission earlier, and it is actually remission. So when you go into remission with your depression, we normally say stay on your antidepressants for at least 3 to 6 months, or even sometimes a year while you're in remission. So while you're feeling better, before you then speak to your doctor about cutting down. And because what we understand is from clinical practice is a lot of patients come in, and when you say, okay, well, there's medication that we can try alongside therapy, what do you think? And they say, oh no, doctor, I don't want an antidepressant because it's addictive.
Exactly.
And the first thing we say
is
not addictive. However, in clinical practice, what we're finding is that people are having these serotonin withdrawal effects. And it's not an addictive effect, but it is the fact
physical.
That it is a physical thing, isn't it? Because your brain has been bathed with so much serotonin. And then all of a sudden you just stop it. And if you stop it at a time when you're not fully in remission, your coping strategies have not been fully firmly planted, you're just getting better, those physical symptoms can actually make you feel really unwell. And people have these symptoms even to 20 milligrams of citalopram. So I think definitely, I think I'm more inclined to do a stepwise reduction,
which makes sense,
a stepwise reduction, and then you just titrate that to a person, isn't it? So you can either do it over 2 weeks, and for some people you might want to do it a bit longer.
Exactly. I guess having that discussion with your doctor and seeing what works for you, and especially if by the time when you're stopping it, you're doing that talking therapies, or you're implementing that in your life, then you're much more likely to be able to stop quicker.
And I think that's where it comes in, isn't it? In terms of having both talking therapy, from a trained psychologist or a trained counsellor, well-being practitioner, to just having the tablet on its own and feeling that at 6 months I'm just going to stop and it's going to go away. But if you have both of them together, then the coping strategies come in when the tablets are sort of being phased out of your system. But just going back to that as well, like, I feel a lot of women, and maybe potentially women as well, because or men, when they're having physical symptoms, aches, pains, body aches, and
Headaches,
headaches, lethargy. Put it down to, oh, I'm just really stressed.
Yeah.
They can be quite flippant about it. And what would your recommendation be? Because actually there's a lot of things that people need in terms of blood tests and vitamin D, especially in England, where people don't take their vitamin D.
Take your vitamin D. Please. I've actually got a post about this. You have to have your vitamin D. You have to have
your vitamin D. The number of times I've had conversations with people and I'm like, do you take your vitamin D? And they're like, no, doctor. It's
like, take it.
It's not. It's a some, I think I've heard people say, oh, it's a synthetic thing.
Yeah.
It's not useful. Oh, I go on holiday for 1 week every year. I get enough vitamin D. And no, it's actually not, because you get a lot of muscular pain and bone pain, fatigue, exhaustion, mood. So there's certain things that actually, if you did have like a good blood work with your doctor when you did go in initially, you might be able to find out certain things. And vitamin D, especially on this side of the hemisphere, is one of the main things.
Absolutely.
Especially if you're slightly darker skinned as well.
Exactly. Yeah. We need more vitamin D to keep you going. The reason we're emphasizing so much about vitamin D is not just because we're promoting vitamin D or we want, it's because
we don't have any endorsements from any companies.
I wish we but it's just how many people we've seen. I go through my blood test every day and you see so many people with deficient and insufficient vitamin D. And that's the reason why we keep saying vitamin D, is because we see it in clinical practice every day. That's a simple thing that can help you basically long term with your symptoms.
Definitely, and the chief medical officer in England has actually recommended that everybody actually in England should be on their vitamin D, and that includes children as well.
Oh, absolutely.
And that includes children, especially because they need vitamin D for the bone growth and bone strength as well, and obviously with adults as well. So what else in terms of physical sort of aches and pains do we find commonly is a problem?
Yes. So actually, fibromyalgia is a diagnosis of exclusion. When that means is other diseases or other problems need to be excluded before someone tells you have fibromyalgia.
That is extremely important.
Things that can mask symptoms of my fibromyalgia. We mentioned vitamin D deficiency. Thyroid problems, that's a very common
and that is so common, isn't it?
Exactly.
It's so common, because people do come in and they're like, just check my thyroid. I want you to check my thyroid. Oh, what's going on? They're like, just check it. And that is something that is actually quite true, because either way of the thyroid, you can actually get those kind of symptoms as well.
Absolutely.
So if your thyroid was hyperactive or hypoactive, you could get either one of those physical signs and symptoms as well.
Exactly.
What else commonly do we see that can cause that?
So most commonly,
I think iron deficiency anemia is also one as well. That
absolutely.
can cause quite
anemia.
Quite a lot of lethargy, tiredness, and things as well.
There are some serious things, of course, that we need to rule out before. But I feel that people, when they read about serious things, they kind of stick in their mind. I've got leukemia, or I've got lymphoma,
or I've got Lyme's disease.
Oh my God, Lyme's disease. That's coming more common.
Yes, it is. It really is.
But it's important to rule it out. So if you think you might have it for any specific reason, then definitely speak to your doctor, because you could possibly have it, but at the end of that needs to be checked.
And so it's so important that if you're getting these kind of signs and symptoms, just see your doctor, speak to your doctor. And the thing about health is, it's not one size fits all.
No.
It's sort of a concierge service, isn't it? And you tailor things to each person, and
that's how it should be, isn't it? Because different people are so different.
And so you tailor things to each person. What is their lifestyle like, and the things that might work for a 23-year-old who's just out of uni with a huge job in the city might not be exactly the same thing for a mother of four who also works at home and in the marketplace, and and is caring for her elderly mother. It is different, and so you tailor things to what is going to suit this person's lifestyle. What are their health beliefs as well? What myths do we need to fight? Here in this situation, and then you just go from there. But I think people need to be open with their doctors and go in and speak to their doctors.
Exactly.
Book time. I think that's also the thing as well. Book time so that you don't feel, the doctor doesn't feel rushed, and you don't feel rushed as well. So if you make sure that you book a good time with your doctor and just speak to them about the things that are concerning you.
Absolutely. There's one thing as well that we should cover is alcohol and drugs, and sometimes that is a cycle, isn't it? You can start it because you're having these symptoms, or these symptoms could be a result of drinking alcohol or taking drugs. So trying to reduce those down and cutting them as much as you can help prevent this cycle.
And that's the thing, is actually that you're so correct, because with alcohol, if you're feeling exhausted and you're so tired, rubbish day at work, and you're so exhausted, you come home, you have a glass of wine.
Yeah, and you can't sleep after that, and then the tiredness. It's a cycle, isn't it?
And then it becomes a cycle. Or you drink, and then you feel a little bit better, and then the following day you do the exact same thing, and then it becomes, instead of one glass of wine, it's 2 glasses of wine, and then before you realise it, you're having 1 whole bottle every single night, and then obviously that then has a knock-on effect on your physical.
Absolutely.
And it's all empty calories as well.
So
it's
a lot of calories.
It's a lot of calories. It's a lot of calories, and it's all empty calories. And it then has that negative side effect, or smoking as well, because you feel stressed and you have a cigarette and you feel that is actually helping your stress, but it actually isn't helping. It actually isn't helping your stress.
Getting this smoker's cough that you're having, and just it's not a good
risk
thing.
Of quite a lot of cancers as well.
Absolutely.
With all that tobacco.
I find it odd that people do smoke nowadays, giving that link with so many different cancers. It's difficult knowing that. I know it's difficult for people to stop, but you really need to kind of take it on board how many diseases are linked.
Well, that's the thing though, isn't it? I think it's the addiction, isn't it, to the nicotine. And I think the nicotine is so addictive, and if people, well, it depends though. I suppose if people had the nicotine replacement in a sufficient way, they might not smoke. But then also there's something about going outside.
It's a habit of holding the cigarette.
Holding the cigarette. Breathing in and out, which is actually a stress relieving activity. But unfortunately, instead of you breathing in fresh air and breathing out fresh air, you're breathing in tobacco fumes and tar. And so it is quite complex, isn't it, in terms of stopping smoking and reducing all of that. And a lot of people who do stop, unfortunately, go back into smoking when they get into a stressful situation.
Absolutely.
And it comes back to what we're talking about in terms of getting in good coping mechanisms that are beneficial and stress relieving, and are not doing harm to you and harm to your body. And obviously something like swimming is so important. You love swimming.
I love swimming. It just helps a lot of things. Helps with heart disease, with just getting the exercise there, back pain, asthma. It's just a good way to exercise, and you can get that meditation while you're breathing in and out as well. So that is us today, really, in terms of somatization and fibromyalgia. So I hope we've answered the question. Yes, women are more likely to somatize. Yes. But fibromyalgia is actually, although it's not fully understood in terms of the cause, it is a real illness. Exactly.
And with time and more research, patients, more scientists, more women in medicine, we might be able to actually understand it better. And I suppose in 100 years, I think the things that we're doing for fibromyalgia now would be so redundant. I mean, so many things would be redundant in 100 years. Cancer treatments today would be redundant.
It's already a lot of things have changed since we were in med school till now. Like HRT. Oh my god, that's a topic that we need to discuss. That is a topic that we need to discuss as well.
Definitely. And so there's so much there. But I think that the really important things are, if you're having physical signs and symptoms that you cannot explain, see your doctor. Have your blood work done. Have an examination done. And if it is fibromyalgia, then discuss with your doctor the things that they've seen in clinical practice that are evidence-based and are helpful, that can allow you to then continue to have a fulfilling life, even with these symptoms. And you'll find that you'll have good days and bad days. But as long as you're able to manage and have still a good quality of life while using your coping strategies, then I think that should be quite important as well.
And knowing that you're not alone and other people do have the same symptoms, try and go to the groups like fibromyalgia groups.
That is so important.
That is very helpful, because the sense of
community,
I'm not
alone.
Very important.
Yeah, I think it's so good when you know that actually you're not the only one.
Exactly. With anything, like if I know someone else is going through the same thing, I'll be like, this is good.
I'm not the only person that is struggling with this or having these problems. And I think that is always so important, because when you feel isolated, then your mental health is also more likely to actually regress, and you're more likely to actually suffer with your mental health, and you feel quite isolated as well with your struggling. So Dr. Lean, give the people a call to action.
Yay. So the phrase, you mean? Okay, so this is a difficult one. We've talked about so many things.
We have, haven't we?
Yes, so just go out there, meditate. So at least basically it's just having this 5 minutes of meditation, and talk about your problems to someone, either your doctor, your friend, your parents. Talk about it.
Yeah, definitely talk about it. And I think the more we talk about things and are open about things, exploring things as well, then the better we would be able to then start addressing issues and confronting the problems that different people face as well. So thank you so much.
For having me.
Thank you for being on the podcast today. Make sure you follow Dr. Lean on Instagram.
Thank you.
And make sure you subscribe to this episode. Okay, subscribe to the podcast and follow us on Instagram, Twitter, and it is a sliceofhealth.club. Okay, until next time.
See you guys later. Bye.
Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And do join the club at asliceofhealth.club, where you will also be able to access the profiles of the guests we've had on today. And don't forget to be a health champion wherever you are by separating health fact from health fiction.